everybody, my name's Hannah Sells and I'm an occupational therapist that's part of, we're not on, we are now, part of the Macmillan Brain and CNS Therapy team, which has been touched on already through the day. Within our team we've got Susie Oxford, who's a physiotherapist who couldn't be here today. We've also got Daphne, our therapy assistant. Just to give you a little bit of a background, because some of you may be aware of us and some of you may not, because we've been a project that's only been running for about 15 months now. It's a 2-year project that's been funded by Macmillan. Like I said, we've been in post now for about 15 months. And the aim of the project was to look at the existing therapy services available for people with brain and CNS tumours, and also map them and start to provide a community therapy service. The area shown here on the map shows what we're covering now. Initially, when we did start the project, we had a much bigger area. We went up into North Yorkshire and we were seeing people over the bridge. Unfortunately, because we are such a small team, we've had to sort of narrow that down really, so that we can evidence in this 2-year project that actually if we can provide the service we want to, we can get the outcomes and demonstrate that there is a need for us. So at the moment we are taking people from the Hull and East Riding area. And we will see people throughout the pathway. So we're based at Castle Hill in the oncology centre there, but we'll see people from diagnosis all the way through to palliative care. So like some of the others, we've broken it down into positive concerns and key issues, and a lot of them are repeated from what people have said, which is probably a good thing, and that we're all sort of coming from the same areas. The first thing I've touched on there is the access to the Specialist Oncology Health Centre and also psychological support. So we've got Catherine Derbyshire, who's already spoken, who offers this patient group excellent sort of psychological input, and we get really good feedback from that. And also the Oncology Health Centre, that people can, any family member also can access the services there. It's not just the patient themselves. Excellent MDT structure, communication and support. Obviously we were a new team developed, and the team have been very welcoming to us and allowed us to sort of take things where we want to. We've had really good support. The third one I've got there is access to the CNS, that they've got Louise, and they've also got access to us now, and hopefully that's lightening the load a little bit, although I think it's probably, because we're taking on more people, we're also identifying more needs as well, because we've got better communications. But our team and Lynn and Louise also do accept telephone calls, and that's something that we offer to our patients around the pathway as well. And the other positive is that now that we're in post, we're able to see people in their own home. Before we were in post, there wasn't really anybody within the team that could go and assess people at home and get a really true picture of how they were managing. So the concerns, again, most of these have already been touched on. Inequity of services across the catchment area. Obviously now we've had to reduce our catchment area, so we are unable to provide that input to the other areas that we were initially. And also before we existed there, as most of you will be aware, there's very clear disparity between what people can access in Hull and East Riding compared to Hull, and then obviously as you go wider and further out, the differences are more apparent as well. The other issue we put there is about, and I think it touches on the infrastructure that's already been mentioned, is about individuals getting lost in the system. Sometimes it doesn't feel that the pathway is clear enough, and we can on occasions come across people who maybe should have had an MRI result, an MRI scan and haven't, or should have had the results and haven't had it back. And I think that's just because we haven't got a clear enough structure of what should happen for each person at each point. And the other concern was about the unmanageable caseload for the CNSs. Like I said, I think maybe us being put into post has maybe increased their caseload as well. And it's difficult being part of such a close team and seeing people who've got such an unmanageable caseload, who are doing an excellent job, but are just so limited by the number of staff they've got. So the core issues, as people have already mentioned, our project is only for 2 years. So we're coming up to the end of that now, and so we're in the process of trying to make sure we're securing funding. So that's one of the main issues for us as a team, and it's nice to see that it's obviously a concern for the wider MDT as well. Again, repeating a little bit around the concern is about the structured pathway, and that it needs to be the same for each patient. And I think also, because there is such a good hub at Castle Hill with the oncology centre, and they have got access to oncology health there, and all the areas, all the patients who live further out do have that access. It's not realistic, I don't think, always for them to be able to travel in to receive that support. So it's about thinking about, is there little hubs or is there other areas where they could access that support, which just makes it easier for them. And again, communication between the acute and the community, I think that just needs to be looked at and strengthened really, and particularly around the IT systems we have in place. They don't talk to each other, and I know it would cost lots and lots of money, but it would make things so much easier if we all had one system, and we could all view what each other were doing. And that's it.